Underground mining, confined space, and IDLH environments are considered to be so hazardous that the less the rescuer has to do to ventilate and transport the patient, the greater the chance of the patient's survival. The O2 CAREvent DRA Rescue Resuscitator is a micro-pneumatic resuscitator developed to rescue miners trapped underground in a confined space, where the atmosphere may be immediately dangerous to life or health, IDLH. How does it work? With the O2 CAREvent DRA Rescue Resuscitator, all that is required is to attach the device to a regulated breathing air or oxygen supply, turn on the gas supply, apply the full face mask to the patient's face, and then secure the airway. The O2 CAREvent DRA Rescue Resuscitator will provide automatic ventilations to the non-breathing patient at a rate and volume designed to provide adequate ventilation while reducing the risk of gastric insufflation. This is in accordance with the current guidelines for resuscitation. The device does not require batteries or electrical supply to operate. The demand breathing feature is triggered by the patient's inspiratory effort, allowing them to breathe at their own rate and volume if their inspiratory effort is adequate. The patient's adequate inspiratory effort will also cause the automatic circuit shutoff to stop the automatic cycling of the resuscitator. If the patient stops breathing again, the automatic cycling will restart with no action required by the rescuer. The manual override button located on the front of the device allows the provision of 2 breaths, followed by 30 chest compressions during CPR, in accordance with the current resuscitation guidelines. In addition, it can also be used to supplement spontaneous ventilations if required. The resuscitator is also equipped with a 2 liter per minute constant bleed flow into the mask. This is to create a positive pressure so that any break in the master face seal will not allow the entrainment of ambient and potentially toxic air. Weighing only 450 grams, the resuscitator is extremely portable and practical to use. What comes in the package? The shipping box contains an O2 CAREvent DRA Rescue Resuscitator, a gas supply hose, and 1 universal SCBA full face mask quick connect adapter. Pre-use functional checks. Along with the contents of the shipping box, you will require the following items to enable you to undertake the pre-use functional check: a full gas cylinder, a gas regulator with a 60 PS 9/16 inch DES outlet. The regulator must be able to output a minimum of 120 liters per minute at no less than 45 psi or 3.1 bar, and a 1 liter test lung with a 15 millimeter male connection. Step 1. Connect the supply hose to the regulator and turn on the oxygen supply. Step 2. Using a mild soap solution, spray the input connection to the resuscitator to check for leaks. If any leak is present, tighten the connection and retest. Step 3. When no leaks are present, connect the test lung to the 15 millimeter female connection on the resuscitator. During the pre-use functional test, you can check the following individual features: maximum airway pressure and audible alarm, frequency tidal volume, manual ventilation, demand valve function, and automatic circuit shutoff, as well as function of the pressure gauge. Note: any units not meeting performance criteria should be returned to the manufacturer or a manufacturer-authorized repair center. Operating procedure. Step 1. Attach the provided supply hose to the gas inlet located on the rear of the device. Step 2. Push the mask connector onto the full face mask. Step 3. If no respiratory effort is observed, position yourself above the patient's head and turn on the gas supply. Step 4. Hyperextend the patient's neck and move the jaw forward using a tilt action. This helps displace the tongue away from the back of the throat and maintain an open airway. Step 5. Apply the full face mask with attached CAREvent DRA or insert the CAREvent DRA into the mask inlet should the patient be wearing a mask already. Step 6. If you choose to use manual ventilation, depress the manual button and observe the rise of the patient's chest. Release the button when chest rise is adequate. When using automatic ventilation, the cycle will restart automatically. Step 7. Monitor the patient's skin, nail bed, and lip color. If mask indicates signs of vomitus, remove immediately and clear the airway. Ensure the mask and valve are free from obstruction and restart ventilation immediately after clearing the airway. Step 8. Continue ventilation until relieved or until spontaneous breathing returns. Constantly observe the patient's pulse and chest movement. Note: when spontaneous breathing occurs, the patient will be able to continue breathing with the device attached to the full face mask. If there are concerns that the patient's spontaneous respirations may cease, do not replace the resuscitator with a breathing apparatus supply, as the resuscitator will recommence providing automatic ventilations should the patient stop breathing again. Cleaning. The resuscitator must be thoroughly cleaned after each patient use. Step 1. Operate the CAREvent DRA automatic resuscitator to blow out any contaminant from the patient valve. Step 2. Ensure that the CAREvent DRA automatic resuscitator is disconnected from the gas supply source. Step 3. Remove the full face mask and airway pressure gauge from the resuscitator. Step 4. Remove the patient connector from the body of the resuscitator, being careful to ensure that the diaphragm is retained. Step 5. Shake out any foreign material. Step 6. Wash the patient valve, diaphragm, and face mask thoroughly in a mild soap solution and disinfect as required. Step 7. The resuscitator can be wiped over with a soft cloth and mild soap solution. Step 8. Dry all components thoroughly. Step 9. Reassemble the unit, connect to an air or oxygen supply to check operation prior to packaging for emergency use. Warning: under no circumstances should the complete unit be allowed to be soaked or immersed in cleaning solutions. Routine maintenance. Ensure that all of the accessories and resuscitated components are present and cleaned. Make sure the air or oxygen cylinder is full and that resuscitator is in working order. Every 6 months, the regulator working pressure, suction if equipped, and ventilator limiting pressures should be checked, and more frequently in high-use applications. Annually, a Level 1 preventive maintenance should be performed, and every 2 years, Level 2 factory preventive maintenance should be performed at an authorized service center. CAREvent DRA Underground Toxic Environment Resuscitator.